Hello and welcome. Today, we're going to talk about something that affects millions of people, carpal tunnel syndrome. It's way more than just a simple wrist ache. And really understanding what's going on is the absolute first step to feeling better. So let's dive right in. So, does this sound at all familiar to you? You wake up, maybe in the middle of the night, and you've got that weird pins and needles feeling in your hand, that numbness that makes it feel like it's totally asleep. It's actually one of the biggest, most common signs that something's up with your wrist. And what's the first thing you do, almost without thinking? You shake your hand, right? You're just trying to wake it up, get that feeling back. It's such a natural reaction, and it turns out it's a huge clue for doctors. Believe it or not, that little shake has a name. It's called the flick sign. When a patient tells their doctor about this whole nighttime handshaking thing, it's like a big flashing sign that points straight to carpal tunnel syndrome. So what is actually happening in there? Honestly, the best way to picture it is like a traffic jam. But instead of cars all jammed up, it's the nerves and tendons getting squeezed inside this really tight space in your wrist. Let's zoom in on the anatomy here. The carpal tunnel itself is this little channel. On three sides, you've got the small bones of your wrist, and then making up the roof on the palm side is this super tough band of tissue called the transverse carpal ligament. And wow, does it get crowded in there. I mean, you've got nine different tendons that you use to bend your fingers, all squeezed into this tiny tunnel. And right in there with them is the star of our show, the median nerve. And here's the real kicker. When anything causes swelling in that tunnel, it could be from repetitive motion, could be something else, there's just no extra room to expand. The bones and that tough ligament aren't going anywhere, so all that pressure builds up, and what's the first thing to get squished? The nerve. It's the softest thing in there, and this just creates a nasty downward spiral of irritation and even more swelling. So what does this nerve getting squeezed actually feel like for you? Let's get into the specific signs and symptoms you'd probably experience. The classic symptom, the one everyone talks about, is that numbness or tingling. But it's very specific. It hits your thumb, index finger, middle finger, and about half of your ring finger. Your pinky? Totally fine, because it's wired to a completely different nerve. You might also start feeling weak, dropping your coffee cup, that kind of thing. And in really severe long-term cases, you can actually see the muscles at the base of your thumb start to shrink. Okay, so you've got the symptoms, but how does a doctor know for sure that it's carpal tunnel syndrome and not something else? Well, they use a cool mix of simple physical exams and some pretty high-tech tools. Usually, a doctor will start with a few simple tests right there in the office. With the Fallon's test, they'll have you hold your wrists bent down for about a minute to see if it brings on that numbness. Then there's the Tunnell's test, where the doctor gently taps over the nerve. If that sends that familiar tingling zap through your fingers, that's a positive sign. Now, to get a really definitive answer, doctors turn to technology. An ultrasound can literally let them see and measure the nerve. If it's swollen up bigger than 10 square millimeters, that's a huge red flag. But the real gold standard is the nerve conduction study, or NCS. This test measures how fast electrical signals are moving through your nerve, which not only confirms the diagnosis, but also tells doctors exactly how bad the compression is. All right, so you've got a diagnosis. What now? What are the treatment options? The best way to think about it is like a ladder. You always start on the first rung with the simplest, least invasive steps. So, that first rung of the ladder, it's all about non-invasive therapy. The absolute cornerstone is wearing a wrist splint at night. The whole point is to keep your wrist straight in a neutral position, which opens up that tunnel as much as possible and just gives the nerve a break. This usually goes hand in hand with changing up your activities and doing some specific exercises. So what happens if, after a month or so, things aren't getting better? Well, you move up the ladder. The next step might be a corticosteroid injection right into the wrist to really knock down that inflammation. There's also a really interesting procedure called nerve hydrodissection, where a doctor uses an ultrasound to guide an injection of fluid that physically frees up the nerve from that tight ligament pressing on it. Pretty cool, right? Okay, this brings us to a super important point. We have to separate what actually works from what doesn't. Clinical guidelines are really clear. Splinting and steroid injections are effective. But what about all those things people try, like grabbing ibuprofen off the shelf or taking vitamin B6? Well, study after study has shown they're basically no better than a placebo for treating the root cause of carpal tunnel. Now, for those moderate to severe cases, or when other treatments just don't cut it, surgery is really considered the best long-term fix. And the goal is incredibly simple: release the pressure on that nerve. There are two main ways to do this. You have the traditional open release, which uses a small 2 centimeter cut in the palm to get to the ligament. Then there is the endoscopic release, which uses 1 or 2 even smaller incisions and a tiny camera. Here's the thing: both are just as effective at relieving your symptoms. The big difference is that the endoscopic method often lets you get back to work and normal life a little bit faster. And get this, the technology is just getting better and better. There are new microinvasive techniques that use ultrasound to guide the whole thing through an incision that's only 4 millimeters long. With these procedures, the average time to get back to work is now just 4 days. Incredible. So whether you've had treatment or you're just trying to keep symptoms at bay, long-term management is absolutely key. How can you stop symptoms from starting or getting worse? And what are the big mistakes you need to avoid? Really, prevention all boils down to ergonomics. And these small changes can make a massive difference. Relax your grip, don't white-knuckle everything. Take frequent breaks. Make sure your desk setup keeps your wrists in a nice, relaxed, straight line. Oh, and a simple one: keep your hands warm. Cold can make everything feel stiffer and more painful. Now, let's talk about what not to do. First, don't waste your time and money on therapies that haven't been proven to work. Also, try to avoid keeping your hand completely still for too long. That can actually make your muscles weaker. But honestly, the biggest pitfall of all is waiting too long to see a doctor when your symptoms are getting bad or just won't go away. And that really brings us to the final, most important question you have to ask yourself. Is this pain, this numbness in your hand, is it more than just a little annoyance? Because here's the bottom line, the ultimate takeaway. Carpal tunnel syndrome is not something you should just ignore or tough out. If you leave it untreated, that constant pressure can cause permanent nerve and muscle damage. So if these symptoms are messing with your sleep or your daily life, the most important thing you can possibly do is go see a healthcare professional and get a real diagnosis and a treatment plan.